Health insurance companies have thought for a long time that, well, if we tell the provider how to describe the patient's condition, then they'll just describe it that way every time and they'll get those prior authorizations approved. So we're going to hide the requirements from the provider. We're not going to show them. We're just going to ask them to tell us what the condition is, and then we'll tell them whether or not it's approved. So how do we fix that? The first step is to share the rules with the provider. Without knowing what the rules are, it's like driving into a small town and knowing that there are speed limits in the town, but not knowing what the speed limits are. And you'll get arrested when you finally blow the speed limit, and then they'll take you back to the beginning of the town and say, start over. It just doesn't make any sense. You need to share the rules with the provider in order for the provider to actually be able to follow the rules. When health plans have started to share the rules, they've done it very poorly and made it hard for the provider to actually find the details for the particular condition that they're prescribing the treatment for. As we look at the challenges of prior authorization and we try and solve this problem, which is very large and is going to take us some time to solve, the very first step is providing transparency. That can go a long way toward relieving a lot of the pain in this process. If the provider knows the rules, they might start with physical therapy instead of suggesting a knee surgery, because they know that health insurance company is going to require 6 weeks of physical therapy before you can get knee surgery. But if they don't know the rules, they don't follow them, of course, and then we have inefficiencies in the process. Again, the quickest and easiest impact right now for prior authorization improvements is to create transparency.